Yes!
Yep.
Playing shuffleboard.
He got knocked out, and police are on scene. They secured the scene, but your patient is in the middle of the bar laying on the floor.
Okay, BSI scene safe.
Scene safe.
My mechanism of injury is a bar fight. Is this my only patient?
Yep.
So I would like ALS on standby, please, and I'm going to have my partner hold the spine in a neutral inline position.
Done.
My general impression of the patient is poor. Hi Nick, my name is Mark. How can I help you today?
No response.
Nick, can you hear me?
No response.
Still rub?
He moans and comes down.
So patient is responsive to pain. Are there any life threats?
Not that you can see.
Patient's chief complaint is that he is unresponsive. I'm going to have my partner do a jaw thrust so I can see in the airway. Is there anything in the airway?
Okay, there's some red liquids and white floaties.
So I'm going to suction the airway. Are we patent?
Okay, airway is clear.
So I have a patent airway. I'm going to go down to breathing. I'm going to cut the patient's shirt off so I can expose the chest. Do I see any trauma on the chest?
Okay, and you do notice some bruising across the chest.
Where?
Left side.
Okay, so I have some bruising on the left side of the chest, so when I palpate, I'm going to keep that in mind, but I'm going to palpate down the ribs.
Okay.
Do I find anything?
Left side has paradoxical movement.
Okay, left side is paradoxical motion. What is his, I'm going to oscillate. 1, 2, 3, 4.
One sounds on the right side only.
Only on the right side?
Mm-hmm.
Okay, so I'm going to, is it flail?
Yes.
Okay, so I'm going to wrap the chest, and then I'm going to have my partner, what is the patient's respiratory rate?
It is 32 in show.
So I'm going to have my partner use a BVM at 15 liters a minute, 1 breath every 5 seconds, and to continue bagging the patient. Now I'm going to go to circulation. I'm going to cut and cover the patient's body. Do I see any major bleeding?
No.
No major bleeding. So what is the patient's pulse?
Pulse is 138.
Okay, what is the patient's skin color, temperature, and condition?
Pale, cool, diaphragmatic.
Okay, so I'm going to treat for shock at this point as well, and I'm going to ensure adequate ventilation of the patient, and my patient is a high priority for transport. I'm going to start my rapid assessment. I'm going to check for decap BTLS from the head down.
Okay,
Anything on the head?
No.
Okay, and now I'm checking the neck. Do I see any decap BTLS in the neck?
No.
Okay, I'm checking for step-offs on the back of the neck.
No.
And I'm looking for tracheal deviation and jugular vein distension. Okay, so I've done my detailed assessment of the neck. I'm going to apply a C-collar. Now I'm back to the chest. I'm going to check the clavicles and the chest, remembering the bruising and the paradoxical motion. Is there any change?
No change.
And auscultation once again.
Okay, you have one sound on the right side and improved on the left.
Okay, and now I'm on the abdomen, so I'm checking all 4 quadrants.
Okay, soft on tender.
Okay, pelvis.
Stable.
Okay, now extremities, so I'm going to check down the leg for decap BTLS.
Okay, right leg stable.
Right. Left.
You notice deformity in the left femur.
Okay. You're not allowed to wear this. Okay, pulses.
Present.
Sir, can you move your feet?
No response.
Pain?
He moans.
Pain?
He moans.
Okay. Arms?
Arms are stable.
Okay. Do you have pulses?
Present.
Pain?
He moans.
Pain?
He moans.
Left side of the chest, right?
Left side chest, left side finger.
So I'm going to roll my patient up, and I'm checking the thorax and the lumbar for any decap BTLS or step-offs.
Stable.
Okay, so now we're going to put the patient on a long board. Okay, before we move, I'm going to have my partner get a sample history, and I'm going to get vitals. What are his pupils?
They are sluggish but pearl.
They're what?
Sluggish but pearl.
Okay, I'm going to get skin color, temperature, and condition one more time.
Pale, cool, diaphragmatic.
Okay, and the patient's pulse.
Is 130.
Blood pressure.
Is 90 over 70.
Okay, I am bagging the patient still, so his respiration should be whatever I'm bagging him at. I'm going to now transport the patient and do my detailed assessment en route. I already did a detailed of the back and the neck during the rapid. So now I'm starting at the head again. So I'm checking in the ears. Do I have any CSF or blood?
No.
And in the nose, same thing?
No.
And is the airway still clear?
Yes.
And his pupils
For
furrow, not sluggish anymore? Okay. I already did a detail of the neck. Do I see any change through the hole?
No.
Okay, so I'm checking the clavicles and down the chest, remembering paradoxical motion.
Stable.
Okay, and do I see any change?
Nope.
And 1, 2, 3, 4.
Equal bilateral.
Awesome. So now I'm on the abdomen. I'm checking each region one more time, or quadrant. Whatever.
Okay. Soft mountain.
Okay, pelvis.
Stable.
Okay, I'm checking for priapism, anal bleeding, any damage to the perineum.
None.
Okay, extremities. So he had deformity in the left.
Uh-huh.
So going down the right, no change.
No change.
Remembering the deformity, going down the left.
Okay. No change.
Pulses.
Present.
Sir, move please.
No response.
Pain.
Bone.
Pain.
Bone.
And now the arms.
Stable.
Pulse.
Present.
Sir, move.
No response.
Pain.
Bone.
Pain.
Bone.
Okay, now I'm going to apply a splint to the deformed left leg. Is there any bleeding?
No.
Okay, and station.
Vitals every 5 minutes.
The very last thing on that page is check vitals for a serious trauma patient every 5 minutes. So he missed one bead in that thing.
It's not a critical.
And it's not a critical. Aside from that, that was fantastic. And that's where we need to be at. So you notice the whole time he was talking nonstop. You can't hide behind the bag valve mask on this one, or I'm going to fumble with the O2 tank. I mean, this is just you showing off in front of a proctor. So we need to get there quickly.
5:59.
5:59. So